Well, look, Tom, really some questions that I think the audience would like to hear about today. By virtually any measure, from everything I've read, mental health is in a state of crisis and has been in our country long before COVID-19. Based upon all the time and years you spend in it and the work that you do in it, because I know you work at the collegiate level as well as the work you do within the company. Can you tell us a little bit about what's your perception and what's going on, and give us kind of your state of the union as it comes to mental health in America today?
Well, I can certainly give you my opinions of that. I have been fortunate enough to work in many venues over the years. I think one of the things that I would continue to focus on, both in the past and current and moving forward, is that the backstop for mental health in this country for many, many, many years has been the primary care providers. Those are nurse practitioners, pediatricians, internists, PAs, psychologists, others who are providing that primary entrance into the behavioral health world by both children and adults. We have had a crisis in this country in behavioral health for as long as I've been in healthcare. The stigma of behavioral health or mental health issues has gone from institutional based back to outpatient based. It is waxed and waned in its ability to serve the American public in varied ways. So I think the real issue here for us to talk about is not so much where it was, as it's always evolving, but we still have today in this country access issues, ability of people to get to the right kind of care, access to medication issues. So fundamentally, while we've progressed, we've not progressed at the same rate as we have in the rest of healthcare.
So, Tom, that's interesting. If primary care is the backstop, as you say, why is that a problem? Aren't all physicians trained at some level in psychiatry, psychology, medically trained? I know when I'm sick, my first thing is I need to go see my doc. So, why is that a problem? Are they not, are there problems with that, and what can be done to remedy them?
Well, I think that's a great question, Jim. I think there are a couple of problems with that, and that is more and more primary care providers are called upon to see more and more patients. The time being spent with patients has gone down, not so much at the behest of the doctor, but at the behest of the system. More needs, more people showing up. We're understanding that more and more of chronic medical conditions are affected by behavioral health. But the opportunity for a doctor to say, tell me really how you're feeling, and spend the time that it takes to understand that. And then again, as you point out, based upon experience, based upon training, psychiatry has become more sophisticated. Treatments in psychiatry have become more sophisticated. And to some extent, it's tough for primary care providers to keep up with all the changes. It's tough to know how to diagnose all these sophisticated, complex behavioral health disorders that we see today. It's difficult to keep up with all the medications that are available in the behavioral health care space or in the psychiatry space. So it's just not something that can be done quickly. It's not something that can be done easily. And for the most part, tools don't exist for primary care providers beyond some very simple tools to do the diagnostics. You can't order an x-ray of somebody's emotions. So we don't have, to some extent, tools out in the general public for primary care providers to use to get those sophisticated diagnoses.